right, today we're here doing a partial bed bath. The most important things is to make sure that we are covering the patient with the bath blanket to always provide maximum privacy, along with making sure that the patient doesn't get a chill. Let's go ahead and get the skills started. Come in. Hi, Mrs. Smith. My name is Lori. I'm going to be your nursing assistant for today. How are you? Good. Could I please see your bracelet? Perfect. Can you go ahead and state your name and date of birth? Susie Jenkins Smith, 12/19/1996. Perfect. I'm going to go ahead and wash my hands, gather my supplies, and I'll be right back. Providing privacy. Washing my hands, gathering my supplies. Now we have a chalk that's going to protect our linens from getting dirty for the table. We have a bath blanket, 6 washcloths, 2 towels, and a gown for the patient. We're going to go ahead and pull up the side rail on this side to protect Mrs. Smith for safety. Okay, Mrs. Smith. I'm going to go grab our water, provide our lotion. This is our soap. We want to make sure that the bath water is warm. We want the temperature to be between 110 to 115. We always want to make sure that the patient tests the water. Okay, Mrs. Smith, does this feel good? Perfect. Well, let me go ahead and remove your call bell. Let me go ahead and put on my gloves. Perfect. Okay, we're going to go ahead and raise your bed. Perfect. We want to make sure it's about waist height for good body mechanics. Good, Mrs. Smith. Okay, we're going to go ahead and get the bath blanket. We're going to put the washcloths, our 7 of them, into the water so they get nice and wet. I'm going to go ahead and open up the bath blanket. Okay, Mrs. Smith, here we go. Perfect. Okay, we're going to go ahead and take down the top sheet. Tucking it in at the bottom to make sure that the top sheet doesn't get dirty. Okay, let's go ahead. You could go ahead. I'm going to help you up by the shoulders on the count of 3. We're going to undo your gown. 1, 2, 3. Perfect. Okay. Go ahead and remove your gown, Mrs. Smith. Perfect. Good job. Okay. Gonna go ahead, open up this blanket. Go ahead and lift up again for me. Perfect. We're gonna go ahead and put this towel underneath you to protect your pillow. Good job. I'm gonna squeeze out the extra water. Now we're going to make a mitt to be able to wash Mrs. Smith's face. You're going to hold the washcloth like this. Wrap it around with your thumb, hold it, and then tuck it. Now we never use soap on the face, okay? All right, Mrs. Smith, we're going to go ahead and wash your eyes. You're going to use the corner of the mitt, one side for one eye of the mitt, the other corner for the other eye. Perfect. Now we're going to change the mitt to the other direction. Okay, same thing, making a mitt. And then we're going to wash her face. Okay, Mrs. Smith, how is that? Feels good? Perfect. Down your neck. And now it's dirty. We're going to use the other towel to pat dry. Is she feeling good? Yeah. Okay, perfect, Mrs. Smith. Okay, I'm going to have you lift up again just to remove your towel. Perfect. Now I'm going to put the towel underneath your arm. Okay, gently raising your arm, holding the joints. Now we're going to apply some soap. Okay, you can never get soap in the water. If you do, you would have to change the water. You always want to make sure that you're soaping one. Okay, now you're going to hold up the blanket and we're going to wash her abdomen. Down the arm. Into the fingers. Okay, Mrs. Jones. Okay, and we're going to discard. Now, if you're dealing with a patient with the breast, you would use the back of your hand to lift at the breast and wash under it. The reason for that is you don't want anybody to think that you're groping. Now we use a clean one to rinse. Okay. Providing maximum privacy down the arm. Okay. Rinsing. Okay, and then we're going to pat dry the same way. Okay, Mrs. Jones, how are you? Doing okay? Perfect. Okay, I'm going to go ahead and remove this from you. I'm going to pull up the side rail. And we're going to move to the other side. Okay, Mrs. Jones. Go ahead and remove the rest of your the rest of your okay. I'm going to go ahead and take the towel. I'm going to put it under your other arm here. Okay, go ahead and lift it for me. Perfect. Good job, Mrs. Jones. Okay, once again, soaping. Okay, Mrs. Jones, we're gonna go ahead and wash this arm. Making sure we get underneath your armpit, with your elbow, hand. Perfect, disposing of that. Gonna go ahead and rinse. Okay, same way. Your elbow, armpit. Okay, perfect. And we're gonna dry. Okay. I'm gonna go ahead and remove this towel from you. Okay, Mrs. Jones, if I could go ahead and have you scoot towards me. Perfect. Okay, we're gonna have you cross your feet. Okay, put your arm up this way and across. On the count of 3, we're gonna go ahead and turn, okay? Okay, 1, 2, 3, turn. Perfect. Awesome. Okay, I'm gonna go ahead and put the towel down to keep the bed from getting wet. Okay. Now we're gonna wash her back. Okay, washing your back, Mrs. Jones. Okay, then we're gonna rinse. Oops. Okay. Now we're gonna pat dry. Good job, Mrs. Jones. Okay. Let's pick up the lotion. Okay. I'm gonna do some lotion. We're gonna warm up the lotion. We're gonna give her a massage on her back. We're gonna go in the upward and around and down and around and up and around and down and around. The massage you should be telling the tester it's for 3 to 5 minutes. We would wipe off the excess lotion. Good, Mrs. Jones. How does that feel? Good? Good. Glad to hear it. Okay. Go ahead and lay back down for me, Mrs. Jones. Perfect. Go ahead and center yourself in the middle of the bed. Awesome. Okay, we'll undo your feet. Okay, I'm going to change my gloves here as they're all dirty from the lotion. Putting on a new pair of gloves. Okay, and another pair. My hands are so sweaty. Okay, Mrs. Jones. I'm gonna go ahead. Okay, let's put your arm in this one. Perfect. And on the other side. Perfect. Okay, I'm gonna go ahead and have you lift up for me at the shoulders. And go ahead and tie it. Okay, perfect. Start to take down some of your bath blanket here. Pull up your sheet. Perfect, Mrs. Smith. Let's finish taking down that bath blanket for you. Okay. You must be feeling nice and refreshed, right? Let's go ahead and lower your bed. Okay, let me go ahead and dispose of my stuff. This in the linen basket. Linen basket. Dispose of my glove. Get rid of the water. We would rinse it 3 times. 1, 2, 3. Wipe the inside. Wipe the outside. Another one, and put this away. This. Take off our gloves. Okay, Mrs. Smith. Is there anything else I can get for you? Would you like a magazine? No. Would you like an extra blanket? No. Would you like your curtain open or closed? Open. Okay, I'll open that for you. Okay, Mrs. Smith. Here's your call bell. My name is Lori. If you need anything else, give me a ring, okay? All right. I would wash my hands, and the skill is complete.